The following was recorded in front of a live studio audience at the Studio 21 Podcast Cafe. This is the United Podcast Network.
This is Africa Diaspora Connect.
Join us as we take the journey from the motherland to America.
We share our experiences and learn from them.
Here is our host, Kibathi and Dr.
We're back. Welcome back to Studio 21, the home of the Africa Diaspora Connect. I am your host, Kibathi and Dr., here to make it to another journey. First things first, thank you so much for all you podcast users. Once again, let's make it audio. That's where it's at. Let's make it a habit. That's where we need to be. And one day you will thank me later. So what's the show about today? Chiropractic is wildly recognized as one of the safest, drug-free, non-invasive therapies available for the treatment of neuromusculoskeletal complaints. I said it. I thought I was going to fumble that word. It is a science, philosophy, and art that utilizes inherent recuperative power of the body to heal itself without the use of drugs or surgery. Healing hands, as they're better known, yet will be another journey in the diaspora. One of delayed gratification, years and years in the making, patience, attention to detail, dexterity, empathy, all in one. The making of a chiropractor. I have here with me my man, Dr. George Mbugua. Vunja mifupa kama meno bado iko. George, welcome, my man. Welcome to Studio 21, the Africa Diaspora Connect.
Glad to see you.
Oh, man, a chiropractor. You know what? Some of us want to be bus drivers. Some of us want to be nurses. Some of us want to be accountants, a lawyer. Man, bones. What's your journey, chiropractor, man? Tell me, what's up with that?
Okay, first of all, can I just tell you that I'm very honored to be here.
Oh, thank you.
I'm
honored to have you as a guest.
And I've been watching your clips on YouTube.
All right.
Very informative.
Thank you.
Very nice.
Have you subscribed? Have you subscribed?
I have subscribed.
Oh, good.
Yes.
All right, good.
Not with my name though, but I have.
So you have an alias. Oh, like, Mifupa. Are you Mifupa? There's someone called Mifupa. Is that you?
That's probably me.
Okay, it's probably you.
Yes.
All right.
But I'm very happy to be here.
All right.
And you have a beautiful audience.
Thank you. Yeah, all these ladies and there's 16 women there and 4 men. You know that's what it is. The balance of life.
It's a very beautiful audience.
24 people.
Yeah. And I know you have viewers all over the country.
All over the world.
Yeah. And I'm happy. It's an honor to be here.
Thank you. Thanks for joining us. Thank you.
Yes.
Take us through your journey. How did you know you want to be in this profession?
I actually did not know I was going to be in this profession. But when I was about 12 years old, I was being a kid.
Yeah.
And I went out there, played and sports, and I was injured. I got a shoulder injury.
What sport were you playing? Marbles?
No, it was a little bit more contact than that.
Okay.
A little bit more contact than marbles. Yeah. So anyway, I got injured and tried all kind of things. I went to my family doctor. They couldn't do anything with me. They were giving me, I don't know if you remember those medications back in Kenya.
Yeah. Aspro.
I was going to say that.
And Cafeno.
Cafeno. And Panadol and all those things.
Malariquin.
Yeah, those kind of things. Mm-hmm. And the problem was not going away. And I happened to be sent to a chiropractor in Kenya. And I'm talking about in the 80s.
They existed?
Yes.
Wow.
Talking about the 80s.
Was it a was it a Muhindi?
No, actually it was a Kenyan.
Wow.
I don't know if I should say his name.
No.
Dr. Adagala.
Yeah, Muhindis are Kenyans too.
No, this one was Dr. Adagala.
Okay, there we go. All right.
So I went to him and he did something to me which I didn't really understand at my age. Well, I felt some kind of movement on my shoulder and neck. And that was it. I did not feel any more pain after that.
He did something to you.
Something I did not understand at that time.
Healing hands.
He had healing hands. I did not understand about that, and I actually forgot all about it. And many years down the road, I came to the United States for further studies. And
what was your major?
I did biology. Yeah, and I minored in chemistry. Then after that, I wanted to join a professional school. Yeah, and I went ahead and applied to all these schools. And I happened to be in Georgia, where they have the biggest chiropractic school in Georgia.
Really?
In the country. Yeah. And they gave me a scholarship.
Wow.
Yeah. So all these other schools, I figured if I had to go to all these other schools, then I'll come out with a lot of debt. But these people offered me scholarships, where we used to do semesters. Every semester they will give me a scholarship.
So Dr. Adagala, from when you were a kid, you knew someone fixed my back, someone fixed my neck, and someone made me feel good. Someone brought me to light.
Exactly.
Okay, and it's always been in the back of your mind. Georgia is here, you got scholarship, and you immersed in it. But
so I went right in,
yeah,
and I went through the education, and I was done.
How many years does it take? Delayed gratification, how many years? From freshman year, as a freshman, up until you became
well, it took about 8 years.
8 years?
Yes.
You have so much patience. Let me tell you, 8 years.
I was young.
8 years.
I didn't have a family. I didn't have nothing.
You know what? You're smart. You know what? All our kids out there, listen. It's all about delayed gratification. Yes.
Yeah. So I was young, and when you're young, you have a lot of energy.
Yeah.
You know what I'm saying?
So people have this misconception: a chiropractor is not a doctor. Can you can you please put that thing to rest right now and tell them what a chiropractor is? Because they say no, he's not a doctor.
Well, it's fine. I mean, I don't take issue with that.
Yeah. Educate
what I think is a doctor is somebody who heals you.
Yes.
If you come to me and you get what you wanted, then also the education part of it qualifies you. Otherwise,
it's a DC. What is a DC?
It's a doctor of chiropractic.
Doctor, yeah, tell them.
Yes.
It's right there. Let them know. Let it be heard.
It's a doctor of chiropractic, and maybe should I tell them how it all came around?
Tell them. That's what we're here for. Yes, tell them.
1895. Gentleman, his name is Dr. D.D. Palmer.
1895. What's that?
1895.
1895.
Yes.
That's when I was born.
He's a little bit white hair. Yeah. 1895. Dr. D.D. Palmer was a man. Him and another guy. His name is Dr. Steels. So these people, they were thinking out of the box at that time.
Yeah.
Because most of the other people, we call them allopathic. I don't want to use all these
allopathic. Yeah, I know what that means. I can even spell it.
Yes.
Yeah.
Most of them, their theory was everything which causes disease, germs. So it was a germ theory. Yeah, and it's been going on for many, many years. But these people, what happened is Dr. Steels was a founder of osteopathy. I don't know.
Of course, I know
you've
that.
Heard of osteopathy?
Of course. I'm one of those.
Osteopathy.
Yeah.
They usually go by DO. You will see them a lot of places in hospitals. You see DOs.
Yeah.
So they started like that, whereby these two people thought outside the box.
Okay.
And they thought about structure and function. The structure of your body dictates the function of things.
Okay.
For like I can tell you, if you have like a short leg, that's a structure.
Okay.
You won't have you won't have function, 100% function.
Because I have a short leg.
Because you have a short leg.
Okay.
You're not going to be. You might be an athlete, but you're not going to be an athlete that you wanted to be.
Okay.
So, D.D. Palmer, his structure was all about the spine. If the spine is not right, then it might press on the nerves which are coming out of the spine.
Okay.
The spinal cord, spine.
Okay.
And you might have problems.
Ergonomics, right? That's all ergonomics.
So ergonomics.
Yes, posture.
So ergonomics usually comes a little bit later.
Oh, okay.
Yeah, ergonomics usually brings in muscles and everything, where they want you to have a nice posture at work, like the way you are right now.
Like that right now, yes.
You have a nice posture.
That? Yes, you see that?
You've sucked the belly in.
Yes.
You have a six-pack.
This is me. Yeah, that's how I roll. So what's your specialty? What do you specialize in as a chiropractor? What is your specialty?
Well, what I do is we do a lot of neuromuscular conditions. Neuromuscular, where is the muscles of the nervous system. That's what we usually take care of.
Okay.
And we take care of things like headaches, people who have disc problems, sciatica. We take care of that stuff. Yes.
This is interesting.
People who have been in car accidents are also people who come to us. Yeah, like people who get it in car accidents, they get. Yeah, go ahead.
That was actually one of my questions. So you get whiplash. Someone rear ends you, right?
Yes.
What happens to your body? For example, you're driving. There's a stop sign. Someone is not stopping. Bang.
I'm glad you asked.
What happens to your body? What happens right there on impact?
I'm glad you asked.
Yeah.
Newton's first law.
Okay. What was Newton's first law? I only went to. I didn't go there. I didn't take that class.
So Newton's first law deals a lot with inertia.
Newton, like Moravi or what?
Newton.
Oh, okay. Inertia.
Newton's first law. He was, Newton.
Yes.
Yeah. What? I don't know. Do I need to explain?
No, just tell me the impact. When you get impact. So when you get rear-ended, what happens to your body? So what happens to you?
When you are like in motion.
Yeah.
Which is that Newton law. When in motion, your body wants to be in motion.
Yes.
So if you have any external force, then the body resists that.
Okay.
And with that resistance of that external force, then you might get injured. So, for instance, you are driving, somebody hits in the back, so you're in a uniform motion.
Yeah.
External force from a car hits you, then now you move like that. And it's not going to be that easy the way
you move back. You say so you're moving back.
So you move.
So you're stationary. You get whiplash.
Exactly.
Okay.
Then you move back.
Okay, your body moves back,
and then you move front. And it's not going to be that easy the way I'm doing it.
Yes.
It's going to be chaotic.
Chaotic. Okay.
Yeah. So when that happens, you're going to injure some of the stuff in your neck.
What are those muscles called? What's that area called?
So you'll have you can injure the ligaments of your cervical. If you want me to go deep into that, you can actually, what can happen to you, you can have a fracture of some of the vertebrae.
That's your back?
No, neck.
Neck. Yeah. Oh, neck.
So here we're talking about the neck.
Okay.
The neck is the one which moves like that. That's the whiplash.
The whiplash, okay.
So if you get a fracture in the neck, that's not very good because it might get right into your spinal cord, and then you might get some big problems, very unpleasant things. You can become
the main
paralyzed.
We don't know. We think we're gonna go home. We're gonna go home, and over time, you're gonna heal yourself because we don't know any better. The key thing is this: if you've ever been in an accident, folks, this is where it's at. If you've ever been in an accident, you've been whiplashed. You know what? Listen, insurance works, okay? Do it. See somebody. Because I've had a friend of mine, this is almost 25 years ago, got whiplashed. They didn't take the time to get treated. And until today, their motion is like a robot.
Yes.
And I don't think it's correctable. Is it after several years?
Well, it can, because what we call it fixation.
Fixation.
That you don't have any range of motion. And
like when they turn, you can tell it's like it's that robotic.
So they turn their whole
exactly.
Body.
They can't pull on the swivel.
Yes.
The swivel. They can't. It's the whole body is what's moving around.
The other very important thing about car accidents is concussion. So people do get concussions, but they usually don't know. So you get hit the way we are talking about that mechanism.
Yeah.
But then at the same time you hit your head on
the dashboard,
or the windscreen,
or
the windscreen, or on the side windows or wherever, and you get a concussion. So what usually happens, you cannot just go home. You need to go to an emergency room or wherever. And
Africans, let's go to hospital. Let me tell you something, Africans. Listen, this thing about going home to think that you're going to get better because sleep is going to work, it doesn't work. See a professional. Seek a professional.
Exactly.
No matter what. Get a clean bill of health. Take the time to understand something just happened to your body, get it checked. And that's our biggest issue, we Africans.
So now you get into all these things, and then if you don't, you have to get a CT scan to make sure you did not get a...
Let's talk about your first visit. What do you expect on your first visit? I just came in. What is my first... I came in, I'm nervous. Something happened to me. What's my first visit like in your office?
So when you come in, we have to take the history.
Take the what?
History.
Oh, my history, okay.
Yeah, we take the history, and we want to find out what brought you here. Is it a car accident? Is it any kind of pain from nowhere?
Yeah.
And we do the history, we do the exam. Now, from all that, then we can figure out, because sometimes a person can come with back pain, and that back pain is not back pain.
It's a product. It's a product of something else.
Exactly. I can explain that to you. It could be something which they call it referred pain.
Referred.
Referred, yeah. So referred pain is coming from a lot of these things. We usually see them coming from the abdomen. Or I've had a patient who came had a problem with the prostate. It was actually prostate cancer, but he came complaining of the back pain.
It reverberates to your back.
Yeah, so
it's like a headache. It's not really. It's like
not,
a headache.
Yeah, so it's not coming from where you're feeling it.
Exactly.
It's a referred.
It's a referred.
It's referred from somewhere else. Yeah.
Okay.
So when we do all the exams and everything, we can figure out if it's a referred pain. We do imaging and all that stuff, and then if it's something as serious as cancer, then you have to refer the person out somewhere else where they can get. I
mean, you wouldn't diagnose. I'm assuming you're working in tandem with a medical doctor, maybe. Is that how it works? Do you work together?
It works. I have a few of them I work with. Yeah. So if it's a case which I think it's I cannot take care of, because you cannot be doctor of all.
Yeah.
Yeah. And that's why even in medicine they have all these specialties.
Yeah.
So you have to kind of refer people.
Let's talk about the payment methods. That's something you brought up actually. I would like you to expound on that. Payment methods.
Payment method. Most insurance cover chiropractic. If you're in a car accident, your car insurance will pay for that. If it's a work accident, people actually get injured at work.
Slip and fall, whatever.
Slip and fall,
yeah,
those kind of things. You go, or you might go lift somebody. A lot of people
working in healthcare.
They work in healthcare. Lifting people. You will, you get a sprain or whatever you get, or your disc. You get problems with your disc. Workman's comp will take care of that.
Workman's comp.
Yes.
Okay.
And we also do cash payments. And the good thing about cash payment is chiropractic is very affordable.
It is?
It's very, very affordable compared to any other healthcare.
So if I came there with a slip and fall outside when I was shoveling snow and I have no insurance, what are you going to charge me for that?
Well, we'll get to do an exam and try to figure out.
No, how much are you going to charge? How much are you charging me for slip and fall? How much are you charging me for my slip and fall?
You might have to come to the office for that information.
It's expensive. It's expensive. It's going to cost you money.
That information, you have to come to the office.
So do potential patients need referral to come to see you?
No, they don't need referral. We can also be like gatekeepers.
Okay.
Yeah, like what I mean about a gatekeeper.
A watchman, like, no?
Yeah, something like that.
Okay.
Yeah, a person comes to you, you see them, and then either you treat them or you refer them somewhere.
Okay.
That's what a gatekeeper is all about with the insurance companies.
So let me ask you this: in your profession, this whole thing with the baby boomers right now, and we're in this United States, actually all over the world, at least in the Western Hemisphere, that population of baby boomers has grown exponentially. It must be a beautiful thing for someone like you, with having all those elderly people getting to that age, the whole population. I mean, how's that making
the outlook for chiropractic because of that is very good. Because as people grow older, problems usually magnified 10 times.
I'm not old. Don't look at me like I'm old.
10 times.
Don't look at me like
you said you were born in 1895.
Oh, okay.
So don't think we forgot about that.
Okay, go ahead.
Yes. Yeah. So anyway, problems usually get magnified.
Yeah.
And neuromuscular problems.
Is arthritis
headaches.
something that you guys do, like things like arthritis?
Yeah, because that's all bones.
Yeah, it's all bones.
Yeah, it's all bones, it's all cartilage and inflammation and all that kind of stuff.
Wow.
I can get into all that, but probably another show.
No. This is we're starting from somewhere. We're starting from somewhere.
Yep.
Your hands are your number one asset.
Yes.
It's all about your hands. It's all you have healing hands. Okay.
That's what they tell me. But,
you have that gift.
Yes.
And I'm sure I'm sure your wife must love you. Your hands must be like gold.
Yeah, when she's my patient, yeah. And she's paying.
So tell me, is it all about? Is there, and like when I go to a massage parlor, I love it, the way the force they apply. But I'm told it's not even. You don't have to be strong. It's not really that. It's something about posture. Can you expound on that? How do you? What is it about your hands? A female chiropractor versus a male chiropractor. You don't have. It's not about strength. It's about what is it about? Tell us. Educate us.
Okay. First of all, massage therapists, they do a very great job.
And I love it.
That's their job.
Happy endings. Go ahead.
Okay. Anyway, so anyway, when we are the chiros, we have a few things we do. We don't just use our hands.
Okay.
We also use instruments for the women because we have little chiropractors, women.
Yeah.
So we have instruments. We have different techniques we use actually. Yeah, we have different techniques where you don't have to use so much force, and we have we incorporate exercise in our treatments, nutrition also. It's a holistic kind of care. We try to make people live a holistic life. Yeah, that's what we do.
This is years ago, when I first had my first back issue, I went to see this chiropractor. She was Vietnamese. She was like 5'2", all right? Chiropractor.
You didn't come to see me. That's a big deal.
Okay, I know that was that's a bit. That was in 2003. So maybe when did you open up?
2005.
Okay, that's why. Okay, so 2003.
Yeah.
She had this thing. It's like on my lower back. So she was using some instrument.
Yes.
She was doing stuff to me on my back. But let me tell you something. I used to look forward to that treatment every evening, 5:35 p.m.
Yes.
Monday through Friday. The force, I could tell the force was there.
Yes.
But it just, honestly speaking, the pain was unbearable. Back pain, I've suffered from back pain.
Yeah, it's not a joke.
It is honestly, folks, for all of you who have had back pain.
You need to try chiropractic or whatever else to take care of that back pain.
And the thing is, it's recurring every 3-4 years. I could bend, I'll go pick up something, a newspaper, just something very basic, and snap.
We call those flare-ups.
Flare-ups.
Yeah.
It just hits you, and you're like, oh no, here we go again. Oh no, and it's right there. And for the next 2 weeks,
you can't do anything.
You can't.
You have to come and we get you a letter to not go to work.
I work from home.
Oh, okay. Well, not you.
but what's this thing?
Some of the audience here.
Yeah, like those guys. What's this thing about?
I've seen some of them. Yeah.
What's about sleeping? What is it about sleeping on the floor? Is that therapeutic? They tell you to sleep on the floor, hard surface.
Well,
does that help, or is that all just some nonsense?
No, some people do get help from that.
I think I do.
But it's not for everybody, though.
Okay.
I mean, it's not for everybody. Same thing. People come to me and they ask me, which is the best pillow? And what I tell them is, I don't know, because I can tell you a hard pillow is good for you, but when you go home and sleep on it, it doesn't work for you. So you have to find the thing which is good for you.
Okay.
Yes. If a hard floor is good for you, that's good.
Okay.
If it's not, then find something different.
We're learning, guys, right here, man. The chiropractic himself, right here. Apex Chiropractic. That's where it's at. Healing hands that you have. And how many bones are there? I'm going to ask you a question, and you're going to fail. How many bones are there in the human being? How many bones? How many are there?
206.
206.
Yes.
Are you sure?
I am.
If I Google it right now.
You can Google. Maybe they added a few, but it's 206.
Okay. Well, if you have 34 teeth, is it 240? Teeth bones?
Teeth, they're not bones, but they share the same minerals.
So why they should be bones?
No. Well, let me explain. I'm not a dentist, but
Okay.
I'll say this.
But think about it. I think teeth should be bones. Should be classified as bones.
Somehow, that's what I'm saying.
Yeah.
Because teeth, they have the same minerals like bones.
Yes.
But on the other hand, bones, they can regenerate themselves, but teeth cannot do that.
Oh.
And teeth, they have enamel, which that's a white shiny thing, but the bones don't have the white shiny thing.
But I thought bones are white. I see.
Yeah,
like,
but they're not shiny.
like Halloween. I see those Halloween skeletons. They look.
Those are teeth. Those are bones made of teeth.
Okay, let's talk about something.
Yes.
You break a bone when you're younger versus when you're older. Let's talk about the healing process when you break something.
Yep.
You're 16 years old, you're playing rugby, bang, you break something, whatever. You're in your 50s and you break something. Let's talk about the difference on the healing factor and what causes that. What really brings it up?
What causes that is because when you are younger, your cells are still growing. You're still very active, regenerating and all that stuff.
Yeah.
Rejuvenating. So it's very easy for a broken bone of a 16-year-old to heal quicker than. Should I mention names?
Yeah, but than a Budesco. Yeah.
So when we grow a little bit older, we don't have the cells are not as active.
Okay.
They call them osteoblasts.
Osteoblast. Yeah,
Yes.
I know that.
Yeah, you know that,
I can spell it. A B C D. Yeah.
So they're not as very active when you are older. That's why it might take you more than 6 months to heal a fracture, as compared to a 16-year-old. It might take them a few weeks.
Wow.
Yes.
So, like going to check up, like they're going for a medical checkup every year, like we're supposed to do. Should we also make an appointment to see a chiropractor every so often, just to make sure things are where they need to be, or do we just come to do when we're in pain? What would you recommend?
What I recommend is, I think people should be seeing their healthcare providers. It doesn't matter if it's a chiropractor, he's a medical doctor, he's a psychiatrist, or whatever. You need to make sure you see your healthcare provider every year. What this does is it protects you from problems which are going to come down the road. Because as we age, we all get problems.
Yeah.
You know what I'm saying? But now when you start seeing these people in an yearly fashion, then they can tell you what's going on, and you can try and prevent that. Actually, we care so much about prevention as chiropractors, and that's where the ergonomics part, where you're talking about it. Yeah. So when you come in, we tell you how to lift, how not to lift, and all, so that you don't have to. I guess I don't know if it's a good thing for us economically, so you don't have to come see us. You know what I'm saying?
But it's like a doctor. They tell us what to eat and what not to eat. It's fine. At the end of the day, we're still going to make the mistakes.
You have to. You make mistakes. We are all humans.
Yeah.
We like to eat our pork chops and all that.
Exactly. Even let's as we wind down. Gym. We're told to keep fit. We're told to stay fit, stay healthy, go to a gym. And I think gym accidents. You would know better. People, you're working out wrong. Your posture is wrong. You're not stretching. All this stuff. What would you recommend to someone who wants to hit that gym, but also to be careful of how they do what they do to results?
Well,
as a chiropractor.
Well, if you want to go to the gym, you haven't been doing it for years.
Yeah, like me.
First of all, you need to go get checked to make sure that you can check by your doctor or whoever, chiro, or anybody. Okay. Just to make sure you are good to start doing. Partake that.
Yeah,
gym work. Because there's some people who just jump in there and they don't know they probably have a heart attack about to happen.
Yeah.
And heart attacks usually happens when you're doing activities.
Yeah.
And then they fall off the treadmill and they're done.
Rest in peace.
Exactly.
Yeah.
So you have to actually see somebody first. If you haven't been doing it, see someone first. And then you get a clean bill of health.
Yeah.
And then just jump into it now. Yeah.
So I see these guys pushing those weights, doing stuff, and they're straining themselves. Like after this, I have to do 25 push-ups here because I'm doing this push-up thing for. It's all about PTSD.
Are you doing with him?
I have to do 25 push-ups here, and I'm going to strain myself. So thank God you're here today.
There's a guy there who looks very big. I don't know if he's the one who's going to be doing push-ups with you.
Please, those guys they're nothing. Leave them alone. They're nothing. But when I'm doing my push-ups here today, so my posture has to be correct. Everything has to be on point, and I need to know when not to overly assert myself.
You're lucky I'm here.
That's why I need you to be here today. Listen, guys, we're learning a
Taking
lot,
care
man.
of you.
This whole world of bones, man. This is it, man. Our posture, everything else.
Posture is
because
good.
what happens? I remember my grandfather. Over time, he started doing this. He slowly as he got older, he could never stand up straight. You know what I'm saying? The walking stick element of it all, it all comes into it, So I guess you guys, we need to incorporate into our lives. Our posture is everything.
Definitely.
Our posture is everything.
Posture is everything, and get loose adjustments.
Get loose.
Yeah, and the adjustments are when you move the bones around, like I do. Then you don't have that fixation. That's a fixation when they cannot.
They're crouching.
Like that.
Yeah, they're crouching.
Yeah.
They're crouching.
So what we do is we remove that fixation.
Wow.
Yes.
So I think you're a bone cracker. You crack bones. Is that what you do?
I do that.
Yeah.
Yes.
So that's one of the things. Like I call you a bone cracker.
I love that.
Guys, listen, welcome. This is a good show here today. We've learned something. Dr. George right here, tolling it in the journey of being a chiropractor. Listen, kids out there, if you're looking for something to do in life, something that you would like to aspire to, hey, listen, think about the baby boomers. Think about the potential there is in this field. Yes, it does take a while. It's delayed gratification, but think about it. All right? Dr. George, thank you so much. We appreciate you. Apex Chiropractic.
That's
Check
a
him out.
punchline.
That's a punchline right there. It's right there.
Yes.
It's right there. Check it out right there. And listen, please be sure to like this episode, subscribe to the channel, and hit that bell icon ding to be notified when your new episodes are released. If you have any questions, comments, concerns, please email us africa-connects@gmail.com. Signing off, Kibathi and Dr. Airwave near you. Thank you, thank you, thank you. Thank you, sir. Thank you.
The views and opinions expressed by the hosts, guests, or callers of this program do not necessarily reflect the opinions of the Studio 21 Podcast Cafe, the United Podcast Network, its partners, or affiliates.